Shaare Zedek today is the largest hospital in Jerusalem. I know that there is another very famous, more famous than us, hospital in Jerusalem, Hadassah, that has a campus on Ein Karem and a campus in Mount Scopus, and is supported by 350,000 women, and I'm sure that this room also has Hadassah members. Hadassah was founded about 20 years after Shaare Zedek, and it was the first medical school in Israel, a very famous and prestigious hospital. But Shaare Zedek in recent years became the only major tertiary medical center located in the center of the city of Jerusalem. We admit around 65,000 patients a year. We treat around 300,000 on an ambulatory basis. We deliver 14,000 babies a year. I think it's a world record in the Western world. Maybe in India, there are larger maternities.
Double Sidusana.
Double Sidusana.
And we're the biggest in the West Coast.
You have 7,000. So it's about 52% of the babies born in the greater Jerusalem area are born in Shaare Zedek, and of course it goes with a very elaborate neonatal intensive care unit. And we have many centers of excellence that I will not list, because really I'm here to tell you about Shaare Zedek, but through Shaare Zedek to develop few concepts that characterize modern medicine. So we'll start with compassion. I mean, even to say, how do you promote compassion in an era of ultra-modern medicine sounds self-contradictory, because medicine and compassion should go hand in hand. And maybe when I speak to American physicians, I may sound strange, and I would like to tell you a personal story from my first day of my fellowship in gastroenterology at Yale University, July 1st, 1983. I was asked by the boss to go and to see a 90-year-old patient, a Mrs. Smith, that had a gastrointestinal bleeding during the night. And we were 8 fellows that year in Shaare Zedek. One fellow, you may know his name is Gary Newman. I know he's somewhere in Pennsylvania today. And we both go to this patient. And she is alert, she is lucid, she had melena, GI bleeding during the night, and we were about to scope her. And I tell Mrs. Smith, as I was trying to say, being very polite, "Good morning, Mrs. Smith. How are you today?" Hoping that she would tolerate and understand my heavy Israeli accent. And Gary Newman is telling this Mrs. Smith, "Good morning, Mrs. Smith. You have the most gorgeous blue eyes I've ever seen." She had 2 cataracts, you couldn't see. But that was the sentence. And at that moment, I understood the difference between American fee-for-service based medicine, and he has one of the largest GI practices in Pennsylvania today, that Gary Newman, and in Israel. Because again, you are moving towards socialized medicine, we are moving in Israel towards private medicine, we'll meet somewhere in the middle, but I understood that American doctors are really courting their patients, you could say, or that would be improper. They are באמת מחזרים אחרי הפציינטים שלהם, and it was well manifested by that approach of Dr. Newman to Mrs. Smith. But this was 25 years ago, and what happened in the last 25 years in modern medicine is that ultra technology came in. And again, to give you another example, when I was an intern in Bellinson Medical Center in Petah Tikva in 1972, and the patient with abdominal pain, with belly pain, would come to the emergency room, so we would spend about 15 minutes or 20 minutes taking the history, personal details, interviewing him and his family. When did the pain start? Where does it radiate? How is it, by what is it aggravated? What eases the pain? Does food do such and such to pain? Does it change with position? We had a series of about 30 to 40 questions, and we would communicate and discuss them with the patients. And then we'll move on to the physical examination, listening with stethoscope, not only to his bowel sounds, but also to his heart, concentrating, closing our eyes, trying to concentrate. Do we pick the first sound, the second sound, some murmurs over the heart, listen to the bowel movements. We would palpate his belly, a superficial palpation, then a deep palpation. All this is being taught today in medical school, and young physicians today are told to do the same. But the physician today, who is an intern or a young resident, when he listens to the voices of the heart or the lungs or to the bowel movements with the stethoscope, he knows that behind the wall in the other room there is an echocardiography machine that is more sensitive to diagnose what's behind the sounds of the heart than the ears of Mozart. And there is an ultrasound machine, and a CAT scan, and an MRI, and a PET-CT that are much more accurate than any of our tactile organs in order to diagnose the problem. And we find ourselves sometimes, although there is still Mrs. Smith with the gorgeous blue eyes, but Mrs. Smith can find herself today in the operation theater without much communication with any resident.
She's got to be really old.
And this is, again?
She's got to be really old today. It was 25 years ago?
Well, I'm talking about the Mrs. Smith of today, of course. So, in any case, there is no doubt that everywhere in the world, including in a medical practice that is based on fee-for-service, where really the physician wants to be liked and to communicate with the patients, that ultra-modern medicine brought with it a certain estrangement between physicians and patients. It's more prominent where socialized medicine prevails, where most of the physicians are salaried and are not paid for spending time with a patient, but I think it's prevalent in this country as well. And the question is, how do you fight it? How do you see to it that compassion will play a central role in doctor-patient communication? To teach it in medical school will not do, because the laws of life and the daily practice dictates what's happening. And if a much more accurate diagnosis and all these diagnostic modalities improve medicine, we are much more accurate in our diagnosis and treatment today. And actually, when I think we went to medical school about the same time, Shlomo, what changed since we went to medical school in every field of medicine. If you take again the field of fertility, one of the most common causes for mechanical fertility is when the fallopian tubes have adhesions and the egg cannot move from the ovary through the fallopian tube to meet the sperm. And what we learned when we were in medical school, that tuboplasty, which was a surgery in order to open the obstructed fallopian tubes with 10% success rate, that's what we had to offer to patients who suffered from infertility. Today, the problem of infertility is actually solved. The endocrine and the mechanical causes of infertility. Today, an infertile couple is only if one of the members of the couple do not produce the proper cells. If there are no sperms at all, or there are no ova, there are no eggs. That's one example to the major advancement in the last 25 years in medicine. If you take the field of cardiology, who could dream 25 or 30 years ago that we will be able to catheterize a 3 millimeter wide coronary artery with an ultrasound probe to map the atherosclerotic plaques in this coronary artery, to do an angioplasty, to suck them out, and to put a stent so that the walls of the coronary artery will not collapse. These are only two examples to give, especially to the non-physicians in the audience, to the major progress that was made in medicine in the last 2 or 3 decades that actually changed longevity, changed in a way, not enough, quality of life of patients, and changed the face of medicine. But with this, as I said before, came certain estrangement. And the question is, how do you see to it that people who are not naturally compassionate will not infiltrate the field of medicine, will not be physicians? It's not so easy. If you start with admission to medical school, the main requirements in Israel and in this country are scholastic achievements. Every congenital antipath could be excellent scholastically. I may even dare say that those who have the maximum results in the MCAT, that's the test here, in Israel it's called המבחן הפסיכומטרי, the psychometrics, maybe tend to be more antipaths and socially secluded. And what you require on admission to medical school, first and foremost, is to be scholastically excellent, to have the best results in final exams in high school, and to have the best MCAT achievements. So medical schools around the world learn that this is not enough. If I give you the statistics from Israel, and Israel, for 7.6 million people, size of Connecticut, in terms of the population, has 4 medical schools. The 5th is about to be opened this year in Tzfat, and I had the privilege to chair the national committee appointed by the Council of Higher Education that made the decision to open the 5th medical school and to open it in the Galilee in order to close the gap in the level of medical services between the center of Israel and the periphery. Again, for you, sometimes drive to work 1.5 hours, that's the time to take to get to the Galilee. You will not even recognize the fact that Israel has a periphery. But one of the main problems of medical services in Israel is a big gap between the ratio of beds to the population, of physicians to population, nurses to population, between the Galilee, the Negev, and the center of Israel, which is around Tel Aviv and around Jerusalem. So this 5th medical school will, we all hope, is the situation like Ben Gurion University Medical School that was opened 30 years ago did for Beersheba, for the south part of Israel.